Dr. Kyle with Project Wellness Company, and today what we want to talk about is headaches and the areas of the spine that we're looking for specifically when somebody comes in for a headache. Typically when we get a headache, we're going to have it right across the base of the skull right here. And this is the number one area if somebody's dealing with headaches when they come into the office that we're going to be evaluating and checking. Because what we want to see is if there's a bone that's misaligned right at the base of the skull here, that we've been putting pressure on the nerves, causing those nerves to then radiate and refer up to the front of the head here. Now, sometimes with that, it could refer to the temples here, it could refer to the front of the head up here, it could be both sides, it could be behind the eyes, because that's where these nerves are traveling to. So it all just depends on what is being pressure applied to from a subluxation or misalignment in the spine and where that point is going to be referring to. And so when we evaluate, essentially what we're looking for, and when we adjust the upper atlas, what I'm looking for is a bone that's rotated, okay? And if that bone rotates or it slides forward or backwards or side to side, what that's going to do is that's going to put pressure on the spine. It's going to put pressure on those nerves, and more times than not, that pressure is then going to refer that nerve pain to a certain region of the head here, giving us that headache. And so ultimately what we want to do is we want to look to see what's causing the headaches in the first place, so that way we can better understand how we're going to correct it and get them to go away for the long term. And so I'm going to have Dr. Bailey lay back here for me. And so when we're evaluating that upper cervical, all of the bones in the neck should move independently of the one above it or below it. And so when we look at the very top here, the occiput is actually the base of the skull. And so what we want to do is we want to evaluate to see if that bone is moving. And so we're going to have a little bit of a movement here where her head, you can see it's slowly gliding. That's what I want to see. It should glide on the left and the right. And so I would laterally bend it and do the same to see if that bone is gliding, which you can see for her it is. And then we come in that other direction, you can see this gliding. So that lets me know that the occiput is clear. We don't have any issues with that occiput. If we come a little bit further down right onto C1, okay, that's what we want to evaluate for as far as putting pressure on those nerves. And so for her today, her atlas is pushing out on her left. So she's subluxated. And so what I want to do is I'll laterally bend her neck to the side. And what this does is it locks those joints out, so that way when I make my adjustment, I'm making a specific adjustment on her atlas in order just to move that bone. And so we'll laterally bend it to the side, and then at this point she would be ready to adjust. So we're going to go ahead and adjust her. And then we come back and we check just to confirm that that atlas is now moving and doing what it's supposed to do. Okay. Now that, like I said, is one of the most common things that we see when the atlas is out of alignment. It's going to be headache, especially in adults. Now if we talk about like kids, you're going to see more of like immune system issues where they get colds often, they get sick, they're constantly having to miss school because they're having different immune system type issues. If a kiddo comes in and they have a fever, that once again is the number one area that I'm going to adjust, because if with a kiddo, if that bone is misaligned, by adjusting it more times than not, we can get that fever to break, the symptoms to go away, and their body to start functioning how it's supposed to be functioning, because that's the power zone when we talk about our immune system and making sure that it's functioning at the highest level.